I was still on Central Time. Sorry about that. Well, thank you for the invitation, Brian. I'm pleased to be able to do this from ETSU to TDH. TDH is Tennessee Department of Health. And I think I've learned a good deal in the last 11 months and 14 days since I last left the Bond House at 7 o'clock in the evening and started at the Tennessee Department of Health at 7 o'clock the next morning in Nashville. And if there's one lesson that I can give to you, don't ever do that. It's stupid, but I do it anyway. I'm the deputy commissioner, and I have to tell the short story that I got introduced to all the 95 county health departments in a meeting in Cookeville back in November. And people were coming up and saying, well, congratulations, Mr. Deputy. It's nice to, it's so nice to meet you. Oh, thank you for coming and all that sort of stuff. And they all kept on calling me deputy. And I said, I got up and I said, my name's Bruce. It's always been Bruce. It's not been Deputy Behringer. I said, and besides, if I'm the deputy, where's the sheriff? Everybody laughed, and I've had no problem since that time. Part of the nature of positions is pretentiousness that comes with it sometimes, and I've never been a pretentious person, and I try to make sure that the distance between the change agent and the changee is as narrow as possible. And you'll see some of that as I come up through this. One of the biggest lessons I think that I've learned, I'm sorry, I had a graduate assistant do this for me one time. Everything goes slowly, is to try to put everything on one page. Everything on one page. Because if everything is on one page, people can see themselves in the big picture. This was my 20-year, one-page thing at East Tennessee State University, having to do with rural issues and trying to find faculty members who were interested in teaching and learning, in service, and in research, and bringing those three together in that circle model of getting people to consider what's in the middle. In the middle were things like community-based scholarship and community service, interdisciplinary leadership, and new partnerships. And all those things around the circle were different projects over the years that we engaged in. And I think the issue, again, was one page, trying to have everybody see that they could be part of a big picture with one page. Well, we have a big picture at the Tennessee Department of Health also. And that big picture starts with Governor Haslam. Now, I've never been political to a large degree. And I got to Nashville, and my interview in the state capitol, things emerged in the conversation. And the two things came up. The first one was that they wanted to know, and they wanted everybody to ask a question of themselves, whether you were in community development, whether you were in education, whether you were, whether you were fixing roads, whether you were giving tickets out. The question was, should government be doing this? Should government be doing this? And the this could be fill in the blank. Should government be doing regulating health professionals? Should government be doing prevention activities in communities? Should government be doing laboratory testing for different types of diseases? And that was the basic question was, should government be doing it? And then if the answer was yes, the corollary became, well, if so, how do we do it more efficiently and more effectively than what we're doing it? So given those, and I nicknamed those Haslam's axioms, and had to introduce them to the governor when he came to visit the Cordell Hall building. And he just kind of looked and chuckled. And he said, "You think you're smart, huh?" He has adopted this concept of a SMART plan. Everybody has goals in their SMART plan that cascade from the boss. So the commissioner's boss is the governor, and the governor's big goal is to be the #1 state in the Southeast for high-quality jobs. And he knows in order to be able to do that, you have to have an educated and you have to have a healthy workforce. And so health becomes part of the governor's job plan for himself, which is part of the goals. So his SMART plan then cascades to the Tennessee Department of Health SMART plan. And Dr. Dreisner and his 3 deputies, including myself, sat for 8 hours over the course of 3 days and came up with Dr. Dreisner's SMART plan of what he thought he needed to do in order to take the leadership of the department and move it in the direction of where the governor was going. And then I had to do mine. And then the people who work in my column had to do theirs. So all these things kind of cascade. And the way that we kind of bridged this concept of the what of the governor's plans to the how, which is implementation, was the Baldrige Performance Improvement Program. And it's that concept of using Baldrige as a bridge to help to get everybody on one page. Anybody familiar with Baldrige at all? 1, 2, okay. Well, I'm going to show you the Baldrige burger in a minute. But the concept, again, how do you put everybody on one page? And the hows include how people see themselves getting on that page through things like a population health orientation to the health department, or operationally aligning what we do with where we want to go. The operational process improvement activities like lean projects, organizational philosophy of a customer-focused government, workforce development, thank you, LifePath, and some other training activities that we'll be involved with. And then the organizational alignment of trying to figure out how we position ourselves for public health accreditation. So all these things are the hows to the what, which goes back to, should we be doing this stuff? And if we do, how do we do it more efficiently and more effectively? So the first big lesson that I had to learn was organizational change. Well, that's what I did for 20 years here. Tried to turn the boat around, as they say, in trying to get people to think about that circle model, right? Service, research, teaching, and learning. Well, at the Tennessee Department of Health, it's basically the same thing, although I'm not using a circle. It's applying learning principles that I learned here to staff development. My job is continuous improvement and training. So a couple examples. One is a community health assessment, phase 1 and phase 2 that we're involved with. I learned a big lesson. I said, this is all voluntary. We're going to do this community health assessment. The first phase was nothing but secondary data. And we took a division of the department who had been known for having all sorts of data but not being able to share it with people because they didn't know how to. They put it on a website. And of course, everybody goes to a website. They do if they've got a master's degree. But if you're somebody in a community wanting to know something, you can't find anything. So the goal that we had was to engage our people in adult learning by having them actually do something. And they created 12 modules using a spreadsheet. And then they put websites in it. And then they put columns in it for the local or the county. And then we inserted state and we inserted national. And then did the percentages for comparisons. And overall, the staff that did this, and there was a group of 8 of them, did this for 3 different workshops across the state. We put this out and asked people, if you would like to volunteer to come and do a community health assessment for your county, send a representative. Now, I didn't know that when the deputy sends out an email, that when you say it's voluntary, you're volunteered. I didn't know that. Yeah, I'm used to university. You say you volunteer, then, well, maybe I'll think about it, you know. Students, well, if it gives me a grade, you know, that sort of stuff. And 93 out of 95 counties showed up. And they sat through 2 grueling days of sitting in front of a computer, learning how to extract data, put it into spreadsheets. Some people had never used Access before, or Excel before, so it was really hard. And then they took it home and they were to share it with their community health councils. So we did that. The second phase of the community health assessment we started a couple weeks ago, and it was the old community assessment course that was taught here. Basically 6 different methods. All the doctoral students are going like this, yeah, we've been there, with the systems course where you take different methods of community health assessment and you apply them to one problem in one population. So it was the people in counties learning how to do by sitting in front of a computer and actually doing it. And it was the staff learning how to put together modules through which community could actually find their health statistics. Another thing that we started in terms of organizational change was strategic topic meetings. We have now an executive leadership team of about 30 people. It was about 30 people when you were there. And these are all leaders of programs, and they're division leaders and office leaders, and they come together every other Friday, and Bruce has a responsibility of putting together the game plan on how they're going to learn something from this 2-hour session. And we've taken on 15 topics so far. So the last one, for example, was how can we define what we can learn from counties involving themselves in primary prevention activities at the community level? So, you know, I pulled out, what else? Diffusion of innovations, and made people go through 4 sets of characteristics, and they had to think about what we could learn, what the promoting, resisting factors are. I introduced who? You know, freezing, unfreezing, Kurt Lewin. This is all stuff that you should know before you get out of here. All these things you should know. All these theories you should know and you'll be able to use. So the strategic topics have been my opportunity to take the leadership of the department, apply theory, and have them be able to use it to look at what they've done. The TPHA marketing. Who was here who went to the TPHA meeting? And who was here who went through the marketing session? You want to say a word about what we did?
Sure. Okay, so we were, I'll have to stand.
Don't hit your head.
So we were split into different groups and given different topics, and my particular topic was what is population health and how to market that to the community and the public. So my particular group came up with a little, well, everyone had to do like a 15-segment audio PSA recording about their marketing strategy. And for me, I thought it was a really great experience, and to be able to work with a group of people that are not only in the health department but also had a position in my group, and me being the only student, and a couple of people from local health departments at different levels. So it was a great opportunity to not only network but also to kind of work together on a marketing strategy, and I thought it was successful. So
The idea was experiential learning. Use experiential methods to address a staff expressed interest in a competency. And the staff expressed concern was nobody understands public health, and it's very unappreciated in the state of Tennessee. So what can we do? So we came up with this little marketing workshop and had our marketing people or our PR people from the from the Tennessee Department of Health give 15, 20, 30 minutes worth of didactic and then send them into little groups. And young ladies like her got to meet the people who were making decisions at the health department. The idea is teamwork, getting people involved with things that they express interest in it. And that was marketing issues. I'll go back to the community health assessment for one slide. One of the things that we wanted people to know was how much they didn't know about their own counties without telling them they didn't know it. Don't ever tell people what they don't know. They have to learn it themselves. So our method of getting them to learn it was to put them in front of the computer for 2 days. They had to come up with issues and had to write problem statements. We did the pre-test and we asked them, tell us what's different about McMinn County. What's different about McMinn County from the rest of the country? What's different about Houston County? What's different about Cumberland County? What's different about Sullivan County? And they all had to write three things down that was different. At the end of the 2-day experience, we gave them a post-test. And we asked them, tell us 3 things that are different about your county, different from the rest of the country and the state. Guess what? 43% of them changed all 3 of their responses. Is that learning? Is that teaching? No. They learned it. They applied what they learned through this experiential method. And I encourage you, as you go forth and get your jobs, remember, you can't teach something that somebody doesn't already know. They have to learn it themselves, and then you give them the framework through which they can express their learning. This is another one of those slides where you put everything on one page. This is the framework we're using for the second community health assessment phase, in which we're going to have each of the counties that volunteered, and this time 49 volunteered. I made sure that they understood you don't have to do this. We even gave them a checklist. If you're not ready yet, you can do it later. So half of them volunteered. And we're using this old model, again, that some people in the room should recognize as aspects of community health, things that are coming from the a day model. This was looking at how do disparities exist? Why do they exist? So you can measure risk and morbidity and mortality. Then you can look at they're actually a factor of characteristics of the population and the community. There are also characteristics of the health services and the system and how they interact or how they miss each other, or in some cases how they combat each other. And then that leads to that interaction of satisfaction and evaluation findings. So again, this whole community health assessment piece is now on one page, because what they learn from doing a community meeting, what they learn from doing a resource inventory, what they learn from doing focus groups, they're going to dump back into this model and say, oh, I learned something about cost, or I learned something about how culture affects the problem that I selected. Systems thinking, another big lesson. This is here, it was interdepartmental, intercollege. At the Tennessee Department of Health, it's working in interdisciplinary environments. And I'll use 3 examples. The first day that I was on the job, I was sent to a safety sub-cabinet meeting. Safety sub-cabinet. This governor's good. He's smart. He's a businessman. And what he did was that he pulled together 5 cabinet secretaries, commissioners, and he said, I want your best ideas of how to improve safety in the state of Tennessee. Your best ideas. I don't want your idea from the health department. I don't want your idea from the education. I don't want your idea from the highway patrol. I don't want your idea from Homeland Security or mental health. I want your collective idea. Your collective idea on what are the things that we can best do to improve the safety in the state. So the first meeting had to do with substance abuse. No small problem. And so the cabinet secretaries and some of their minions like me had to sit around the table and think about what could be done. What could be done administratively, what could be done legislatively in order to be able to bring about change, which would then enable the substance abuse problem, the epidemic that we have in the state of Tennessee of substance abuse to be addressed. So he's worked that through the legislature in his first year. We ended up with the Prescription Safety Act. We ended up with a controlled substance monitoring database. We've ended up with a training program that all the health sciences will be offered across the state, health science students across the state. There's just a whole bunch of things that were put into the legislation. And the key to the legislation, of course, was it was nobody's idea. It was the group's idea. Another one that I got involved with very quickly was the Governor's Health and Wellness Task Force. The original thought was, well, there was a cardiologist in the room. And the thing that we could do the best to improve the health and the wellness of the people of Tennessee was to see to it that stents were placed properly. Well, we had to work backwards a little bit on that one without hurting somebody's feelings. And it has ended up over the course of almost 9 months now. It's ended up with the governor going to be announcing a large obesity initiative. And it's going to be one of these initiatives without money. I saw that. Without money. What can you do without money? And what he's done is that he's convinced the business community all across the state that it's in their best interest to work on obesity. Because if they don't, it's going to cost them money in the long run. So the issue is, how do you get them to make investments locally? How do you get people to work together locally in order to address the obesity issue? Another one that I got involved with, this is Bruce shooting off his mouth, as nobody would imagine that I would. A lady came over from the governor's office and said, we have a children's cabinet that's been created across departments again. And we have to do a statewide assessment, needs assessment. And we have this federal grant to do this needs assessment. And we want to know what kind of ideas, what should we be assessing? And she rolled out some ideas. I leaned back, I said, well, that's a little traditional. She looked at me, what do you mean traditional? I said, well, you could get more exciting than that. And what we've ended up with was, rather than looking at secondary data, and rather than taking reports from all these different governmental entities, we're actually doing community focus groups about early childhood education and school readiness of children ages 0 to 5, which is getting us into some really interesting issues about parenting, about services that are offered by the state, about community support systems for young children, all these things. Again, it came, and the report has to go back to 6 cabinet members: children's services, human services, health, mental health, I can't remember, education, somebody else, 10 care. But the idea is going back out to the community and asking them what they see the issue is. And the final one was last week. I was volunteered because I was a deputy to go to D.C. for a SAMHSA Academy on Children's Mental Health. And the idea there was mental health had to invite a deputy from health in order to be able to have their proposal accepted to go to D.C. to look at these issues. More and more and more that I see at state government, just like I saw at ETSU, if you don't know how to play with other people in other professions, you're going to be lost and you're going to be behind and you won't get jobs if you don't know how to play with other people and if you don't know how to play in teams. That means across disciplines, that means across income ladders, it means across race and ethnicity. You have to know how to play well with other people, or else you're lost. Quality and performance improvement leading to accreditation. Tennessee Department of Health is a large organization. We have 5,440 employees. We are located in 95 counties of the state of Tennessee. It's a big place. I thought the university was big. Had all these little nooks and crannies of programs and offices and that. Don't hold a candle to the Tennessee Department of Health. And what I was told was that I was to look at developing a Tennessee Center for Performance Excellence application. This was Baldrige. And the approach that I took was a participatory method. Thank you. Yeah, a participatory method. And this is what Baldrige looks like. Gary Mays up in Sullivan County calls this the Baldrige burger. It starts off with an organizational profile. Then you have to assess your own leadership and strategic planning. Then you go down to a customer and market focused. You have to be able to identify what you've measured, analyze it, and turn it into knowledge, not just facts. Then you look at the workforce focus, process management, and then look at results. So we had to put together a report on this and submit it to the Tennessee Center. So my game plan, like we did here, was I need 13 representatives. And I divided the health department into 13 units. And I said, everybody take this schedule of questions and interview somebody you don't know. Go to a different part of the department. And they did these interviews, brought them back. We ended up with 75 pages worth of qualitative data. And then we had to crunch that down into 5 pages. And we used that group. And then we used the executive leadership team to sort through all that in order to be able to come up with what we thought we were doing at the Tennessee Department of Health. The idea of performance improvement is you can't start that until you have a baseline. You have to know where you are to know where you're going. So we used the Baldrige approach. Remember, 1 page, everybody's on it. The Baldrige approach in order to be able to move forward. We've done some smaller things too. We've used assessment to create the theory of the problem. Anybody recognize the term? All right. The theory of the problem. Why does this problem exist for that population at this time? So we've used assessment to do that. And we've used logic models. Logic models? Anybody recognize it? Everybody in the room should be waving their hand. Logic models, if you don't get them yet, you better learn them because this is the way life is moving. Logic models to create the theory of the program. Theory of the problem, theory of the program. I'll give 2 short examples. One was we had this Office of Minority Health and Disparities Elimination that had been getting money from the General Assembly for years. And when I walked in, I said, so show me what you've done. We've given grants away. Show me what you've done. What did those grants do? What change did you bring about? We've given grants away. We're addressing obesity in the African American community. I said, where? 4 cities. I said, are there not African Americans in more than 4 cities in Tennessee? Well, yeah. Well, what are you going to do to reach out to help them? So what we came up with was 2 strategies. One is a small grant strategy, and the second one is something we're working with the historically black colleges and universities. Gave them tiny money, $15,000 for each of those 5 colleges, and asked them to create and innovate some ideas of how they could help their students to think about obesity. Well, this could be fun. They came up with the best assortment of obesity prevention and reduction projects I've ever seen in my life. Ever in my life. They came up with this huge number of projects. Now, they can't do that for $15,000, but it was unlocking their minds about a problem that they knew that they had, but nobody ever asked them to deal with it. Nobody ever asked. So we give them a little bit of money. We tell them to create. Don't worry about accounting for $15,000. What we want is the creativity. Show us what you can do. And they're starting this month. And, 6 months from now we'll know, or 9 months from now we'll know how much they've been able to do and what types of creative activities they've been able to do on their campus, with their students, with their campus community, and then with the community that surrounds them. Because the idea is no university exists without the community that surrounds them. And they bought that philosophy. The other thing was Project Diabetes. When I was here, Project Diabetes was, well, it's either 100,000 or 150,000 or nothing. And we never got nothing up here for some reason. And what we did was that we went and we asked them to show us exactly what had been accomplished. Show us what you did. And they gave away money. They gave away grants. They could tell you how many people had been seen. What has been done about diabetes? What kind of new relationships were created? And what we ended up with was the idea of creating small grants. So this year, when the Project Diabetes RFP, request for proposal, hit the website, we set aside 15 small grants of $15,000 apiece for each of the 3 grand divisions of the state. 45 small grants to get people thinking, get them started, creating relationships, new ideas, not $150,000 ideas, but $15,000 ideas. Things that small communities could get their hands on and try to move forward with. So performance improvement, I think, doesn't come in big chunks. It comes in helping people to see that there are different ways and that they can approach those different ways with small pieces. Here is, oops, oh, geez. Ah, good. This is the model. This is performance improvement in a different way, starting with our community health assessment with just doing secondary data, moving over to a focused assessment, which is phase 2. The first one is identifying the health issues, starting with the population and identifying problems. Phase 2 is starting with the problem and identifying which populations have that problem, identifying and discussing the problems and causal factors, which improves the diagnosis or the assessment of community health issues, which leads to the development of better intervention programs. That thing looped back gives you performance improvement. So our approach to performance improvement is active learning. It's not sitting back and counting everything. It's getting people to think actively and to play those things out. One final set of slides here. The moving plates of healthcare. Yeah. Who's spinning the plates? You've been to the circus where people do this sort of stuff. That's what healthcare is to me. You got a bunch of people spinning individual plates and nobody's in charge. You get spinning plates, you got healthcare, the reform, the structural stuff that's going to happen, and the government deficits, which is going to blow us all away, and the national political rejection of a single system. I'm old enough that I've watched it 3 times. I watched it in the Nixon administration. I was in D.C. as part of the effort back with the Hillary Gate stuff. And then this time around, I chose not to go to D.C., but to watch it from afar. But they're going like this. We had 3 opportunities to try to create a system, and the American public said, no, we don't want a system. We want freedom of choice. So we have continuing rates of obesity and smoking. We have poor health outcomes. We've got the old and the new substance abuse issues. But keep thinking about spinning plates as you think about accountable care organizations. That's defining new roles within a new healthcare system where cost, delivery, and outcomes are linked for the first time. Cost, delivery, and outcomes are linked for the first time. The only other place you're going to find that in the entire country, the VA. The VA. Cost, delivery, and outcomes are linked. They are the microcosm for healthcare reform in this country. My presumption is that poor health outcomes are due in large part to the lack of organization of services and into systems. We have all sorts of services, excellent services. People come from all over the world to use our services. We don't have a system. Things aren't connected. So people go and fall between the cracks of the services. The question becomes, what role can public health play in a reformed system? And the approach that our commissioner has taken is that we need to go back to the roots of public health, And county health department staffs are going to be sent into communities. Does this sound like barefoot doctors? I just keep thinking, no. Sending them back into communities, creating partnerships, and generating action. They have selected from among, we've just done one so far in Bedford County, and then South Central is going to start it this month, and then by January, the whole of the 95 counties in the health department will start doing these primary prevention initiatives around infant mortality, smoking, teen pregnancy, obesity, immunizations, or substance abuse. They'll select one, and they'll go out into communities. I encourage you strongly, your public health people, learn how to work in and with communities now. Don't wait till you get a job, because you may not get one. If you don't know how to work in and with communities now, you can put it on your resume, and those people at the Tennessee Department of Health are going to be looking for people who can say, I did that in Rogersville, or I did that in Sneedville, or I did that, or I did that, or I did that, and learn how to track what you did and be able to answer the question that Bruce asks all the time to anybody that he interviews. So what'd you learn from that? Be able to track what you've learned from everything that you've done, because I think it will be increasingly important. This is just an example of stuff that we're feeding to people to have them think about primary prevention. How big is your obesity problem? Paradigms like the battle of the bulge, what the scientists tell us. Do your reading. It's not just for academic purposes, it is for professional development. Do the reading. These folks here are smart, the faculty members. They stay on top of their reading. They know what you should be reading. And if they give you that supplemental reading list, that's for professional development. That's not for your course. It's for professional development. And you need to read all that stuff, because the more you know about what's going on right now in the United States about healthcare, the better chances are you would get a job that would enable you to be able to address those. I'm not going to go through this. Oh, I will this. You want to take on an issue? This is an issue for Northeast Tennessee. I can show you map after map after map of stuff that we've thrown up to try to get people interested in stuff. This one and the NAS problem of babies being born addicted are the two major problems in Northeast Tennessee. This institution should not exist if they cannot help to address those two issues. And for some reason, they're both around the same population. Pregnant women here need more help. Not just to deliver prenatal care, but to help them not to smoke and to help them not to use painkillers. Very, very important. Anybody who can take on an issue like that and help that population, more power to you. Final comments. Theory is powerful in helping others to understand their situations and their potential solutions. If you can learn theory and help other people to apply theory, social behavioral theory, you're going to be a good public health person. Learn about different organizations and systems. Your ability to work in a system is directly proportional to your ability to learn how that system works. And if you avoid learning how it works, if you avoid learning the organizational boxes and who's really in charge here, those sorts of things, you won't be able to accomplish what you want to accomplish. Identify the mission, vision, and values as a framework through which you can work, but also innovate. People are looking for innovators now. They're not looking for people who can just do. They're looking for people who can bring new ideas, new thoughts about how things can happen. Our mission, vision, and values are related at the Tennessee Department of Health to primary prevention, protection of the population through policy and regulation, customer service, and workforce excellence and development. We're going through strategic planning. Last Friday, we spent 8 hours together again, coming up with our core values and our domains of value, and that's those 4. And remember, in the long run, it's the relationships that make things work. It's the relationships that make the difference. If you don't create relationships with the people you work with, or the program that you work with, or if you're at the county level with the people at the state and region, or if you're at the state with the people in the counties, or across departments, if you don't create relationships, your ability to do is very, very limited. The reason why you're in college is to put all sorts of different people in the same room and to learn from them, learn their perspectives. College is the best place to learn because you have so many different things going on, and be able to create from that learning this ability to create relationships, which will make your work much better. And that's the final slide I'm using all the time now. This is cute. And the mission of the Tennessee Department of Health, I've been running around for a year now saying, you remember Chatty Cathy, the doll? The mission of the Tennessee Department of Health is to protect, promote, and improve the health and prosperity of people in Tennessee. So I've got people walking up to me going, the mission of the Tennessee Department of Health. That's our mission. And I woke up, now the 2 commissioner goals had to do with primary prevention initiatives and then people-centered performance improvement. I woke up in the middle of the night, which I'm prone to do, 4 o'clock in the morning, and I said PPI, Primary Prevention Initiative. So we've been PPIing now for 6 months. And then I woke up and I said, promote, protect, and improve. Oh my God, another PPI. And then about 5 o'clock I said PI, Performance Improvement. So I went to the office and Dr. Reagan said, yes, people-centered performance improvement, another PPI. So I emailed the commissioner at 7 o'clock in the morning and I said, we got 3 PPIs. He said, no, we don't. We've got 4. Passionate people innovating. That is what the Tennessee Department of Health is about right now. Passionate people innovating. 40% of our workforce will be gone in a matter of 5 years. I'm one of them. And you need to know that there's going to be jobs all across the state, those 5,440 people. There's going to be lots of jobs. We don't have enough people who are trained in public health. I think it shows in this state because of our rankings and because of our poor outcomes. You are the hope that we have that you can come back and you can fill in those positions and you can make us be a better state in the long run. Thank you. Not bad, only 5 minutes over.
We have time for a few questions.
I'm really not that scary. Am I? No. Megan said, no, you're not that scary. Good. Yes, sir.
On the map that had the prevalence of smoking.
With pregnant women.
With pregnant women. Around the large cities in Tennessee, the prevalence was really low.
Mm-hmm.
What is it? What the health departments are doing there, or is Is it just a demographic thing?
So what's the relationship? What's the key relationship? Say it louder so they can hear you.
Socioeconomic status.
And is it better or worse in the cities? It's better. What's the second factor that smoking is related to? Education. Educational status in the cities is much, much better than in rural counties. So that may be one of the factors, going back and looking. What you're raising is, what are the causal factors? And that's what we hope in this next year through our primary prevention initiative and through the community health assessments. We get the counties to tell us what those problems are. Have them dig into it and try to figure out what that is. Go out and interview some pregnant smokers. They're experts, right? Make a great focus group as they're puffing away, making their babies smaller. Yeah.
So,
Dr. Baker.
not yet. Almost. So say you have a passion for maternal and child health, and say you have an interest in substance use, and say you have a decade of appropriate public health-based training. How do you strategically place yourself to make the difference that you want to make in the world? Is it from or in East Tennessee, is it from a state position? Is it from a academic position? Is it from a community-based position? Is it from a nonprofit position? I think that we get very sophisticated training and we're very aware of the problem and can be very rooted in the community and still not know from which vantage point to best tackle the problem.
Yeah. Well, my goal, the commissioner's goal, is to get out of Nashville and get into the state. That's our goal. This is a big state. It's 10.5 hours from Mountain City to Memphis. It's hard to do to get to the state. But guess what? This commissioner visited all 95 county health departments in his first year. Nobody has ever done that before. He sent a message. He wore himself flat out. But he sent a message that every county in the state counts. So being rooted in the counties is important. Being involved with academia is important because people, believe me, they respect people from academia. What we need to do is to force our folks in the central office to meet more people, to get more people involved so that the folks in the central office and the regional offices know who the folks are who are interested in those topics. The dating game, you know, it's the same thing we did on campus. How to get people who have similar interests to know each other. It's not easy, but we think by pushing people out and then pulling people in. An example, Dr. Warren, Michael Warren's in charge of family health and wellness. He was going to have a traditional maternal child health conference last week, or 2 weeks ago. It's a traditional conference. You know, bring in the experts, have people listen and then go home. And we talked about it, and I said, well, you know, one thing we did at ETSU around cancer and around substance abuse was that we made people come in community teams, multi-stakeholder teams. He said, well, why would you do that? I said, because they had to take a plan back home. And then they could use what they heard from the experts to be able to help to frame a plan to go back home. Those experts are people like you who know things. You're not going to tell them how to do things, but if you tell them, so this is skin cancer with little girls, right? And if you're interested in skin cancer, this is what the data tells you, and this is what interventions have done. And then they can go, well, I might be able to do that. So the idea is you're in a good position, but we have to make sure that we can push people out and bring people in. That's part of our job as the leadership of the department. Michael.
Let's say you have this, all your knowledge, but you're going back and working on an undergraduate degree in public health. What would you make sure you had listed on your resume to get the attention of yourself and your colleagues in Nashville?
I would say three things. Now you're talking to me, not anybody else. I think having to present something is very important. Being able to say that I took an idea, I was able to write this idea up, and I was able to present this idea in a professional forum is very important. Because when you start working in public health, a lot of what you're going to do is in public forums. And to be able to show that you've done that before is very important, even at the undergraduate level. Being able to say, I presented to the student forum on such and such, or I worked with the Diabetes Association and I went out and I did a group with so-and-so in a different county. Being able to say you presented. That's number one. Number two, being able to show that you did something in a community, because after all, this is public health. This is not the College of Medicine where you're dealing with individual patients. Your job is population health. Populations are all over. You have a student body population, but you also have community populations. And I think doing something in communities. And then the third thing is placing something in a resume which encourages somebody to ask that question about, so what did you learn from all this? What do you think you can contribute from what you've learned to my department, to the job that you're applying for? Try to encourage them through some way in your resume to get them to ask you that question, and then be prepared to answer it.
Anything else?
No questions for me? You have no questions for me? No?
Well, thank you very much.